Hello, everybody. Welcome to our speaking extra session today, where we'll try to explain what are the most important details of the speaking task during our OET examination. I'm Andrea Berekhout, and I will work together with my colleagues and our students to make the speaking tasks a bit more understandable and to ensure that you will have great results in your exams. Welcome to our Andrea Berekhout Academy. The speaking task is considered by many, let's say, being the easiest one, and somehow they are right. And why? Because many candidates of the OET examination come from abroad. So they are overseas doctors, nurses, dentists, or pharmacists. And many of them have already studied in English, have already studied medicine in English. For the rest, mainly for European candidates, the speaking task might be a bit challenging, given the criteria that we need to accomplish. Remember that you need to be fluent in English, that you need to use good grammar, especially interrogatives and negatives, which you do not use in the letters, in the writing tasks, which consist of letters, and that you need to establish a report to the patient. Do you know how many types of questions we can address to the patient while we accomplish the tasks? How many types of questions do we have? We generally deal with two types of questions, open-ended questions and closed-ended questions. Do you know when we use ones and when we use the others? Well, the open-ended questions are used at the beginning of your dialogue, of your task, of your role play with the patient, because you, for instance, will ask to tell you the story of their disorders, of their conditions, and you will say, can you tell me what happened? Or can you tell me what the problem seems to be? So this is an open-ended question because you allow the patient to answer freely without posing limits or restrictions. And this, as I said, will be used at the beginning of the speaking task. The other types of questions, the closed-ended ones, are recommended for the rest of the task when you will need to direct the conversation and to report yourself all the time to the patient. So after they have described their problem, for instance, you can ask information such as, does your back hurt at night? This is a closed-ended question because they will answer with yes or no, right? So when you want to manage the patient into the direction of your task, you will ask closed-ended questions. So I have open-ended questions at the beginning and closed-ended questions for the rest of the dialogue. I remind you that the tasks will have around 5 minutes each, and you will need to reach those 2 role plays for every exam. So Anda, if you want to take it over from here, please.
Yeah, sure. Okay, so as you may know, maybe not all of you, the speaking task consists of 2 role plays. Okay, so not just one, where you will have an interlocutor that will play the role of the patient. And of course, you will be either doctors or nurses. So we have a medical type of speaking card or a nursing one. This will take approximately 20 minutes. So you have 2 to 3 minutes to prepare for your role play, and then around other 3 minutes to actually do the dialogue with the interlocutor. I will want to discuss with you a few speaking strategies before actually doing a speaking card together. Because so I have selected the most important ones. Of course, we have a lot of strategies, but the most important ones that you should follow are probably the following. So first of all, treat the role play as if you were with a real patient. That means allow time to establish a relationship, a connection with the patient, and ask the patient for relevant information. Okay, so it's very important that the evaluator see that you have established a connection. Okay, as if you were with a real patient and you were actually preoccupied for him, etc. Okay. Another important thing is, as Mrs. Burkhout mentioned, the fact that it is not your medical knowledge that is being tested in this part of the test. It is your ability to communicate effectively in English. Okay, so medical knowledge is not important. If you don't necessarily know what type of advice you give for a certain condition, it's okay, because they do not care about that. Okay, you can say anything, but it must be, you have to do it in a correct and fluent way in English. Another very, very important strategy is pay attention to the type of information that you need to communicate to the patient. Okay, and adjust the way that you do so the way that you communicate this information for different situations, for different contexts that you might have. For example, if the patient is being given bad news, you should always show sympathy, empathy, kindness. Or if a patient is really nervous or worried about a procedure, you will need to offer them reassurance. So it's very important that you not only speak fluently and correctly in English, but also transmit some emotions, transmit that you feel sorry for that patient, transmit, try to reassure him. Okay. Another very important thing is use your intonation. So don't just use words. Don't just use correct words. And for example, if you want to empathize with a patient, don't just say, "I feel very sorry for you." Okay, while not transmitting anything with your intonation. So your intonation should also be used, yeah, to show regret, to show why not happiness if there's good news. Okay, so the rise and the falls of the voice, yeah, you should use it to transmit emotion as well. Another thing is, read before starting the speaking itself, read the role play card carefully so that you do not misunderstand anything that you should do, or that you don't miss out any of the bullets that you have there. Okay, you will see in a moment that we have generally 4 or 5 bullets. Okay, try not to miss any of them, because it's important to follow and to, of course, to follow what they're asking from you. Okay, now pronunciation is also very important, so try to pronounce words as clearly as possible. Okay, so that a word is not misunderstood by the evaluator or even by the interlocutor. Okay. Another thing that some students do is memorize long answers. This is not a good strategy. So memorizing long answers is not a good strategy because, first of all, if the assessor, if the evaluator thinks for one moment that you have memorized a long answer, they will not assess you for that. Okay. And secondly, as I was saying, each card is different. It gives you a different context. So you cannot memorize an entire answer. Of course, we can learn certain questions that we should ask. Okay, short questions. That's the idea. For the beginning, for the ending, or for the middle part. Okay, but not entire answers. So you should practice until you correctly know how to adapt to the context that you are given. Okay. Another thing that is really important is your vocabulary. So medical knowledge might not be, but the vocabulary you use, yes. It's important to use varied vocabulary, so a wide range of vocabulary that matches the needs of the patient and also the context of the role play. Okay. So you need to show that you are able, that you can communicate with the patient in a variety of ways. Okay, and for that we need vocabulary. We need to enrich our vocabulary. Okay. Another good strategy is, even though you will probably be nervous because you have to speak in front of a complete stranger, and then you will later be assessed for that, try to speak clearly, loudly, and confidently. Okay, so the interlocutor can hear you, and so that the assessment shows that you actually have what it takes to pass that speaking part. Okay, now before actually starting the speaking, what I suggest and what is recommended is that you make brief notes. So brief notes for each point on the card, okay, for each bullet. And again, you can include ideas, short ideas or examples, but not full sentences, because they want to see you speak, not read. So, okay, we can write down, for example, I don't know, treatment, aspirin, something like that, or quick question, have you ever, okay, and depending, but that's all, that's the only thing. So not full sentences, because you are assessed for your speaking, not for your reading. Okay. And another very important thing that you should take into account is be aware that the patient's card, yes, so the interlocutor, the patient's card will include information that is not included on in your role play card. Okay, so what does this mean? That your card will not fully prepare for what follows, or for everything that the patient will ask or will say. Okay, of course, it should give you a good idea of the outline, yeah, that the conversation will take, but it will not fully prepare you. So, for example, a patient might become angry at the solution that you are suggesting, or at the situation. A patient may become reluctant, and so on. And that you do not know. That is only written on the patient card. Okay, and you only with practice can we be fully prepared for everything that might come to us.
Okay, so remember to be kind, to be warm, to be empathetic. These are the words that we need to use in our speaking task, and I think we can go directly to a task. So what do you suggest? Should we start with the part for nursing or medicine? I'm open. Let's vote. Who wants nursing first? Hands up, please. Only Magdalena? Okay, who wants and Christian? Okay, who wants medicine first? Nobody. Then I would, if they don't want medicine first, then I will start with medicine. And because I have some doctors here, please, Anda, prepare the card for medicine, and I will choose myself, if you do not mind, everybody. I will choose the ones to complete the task, and I will take Dani. I know that you love me. I love you too. And and somebody else. Let's see. Ana Maria, Sajini, Cristina.
I will go ahead.
Sajini?
No?
Yeah.
So you will be the patient, Sajini, right?
Oh, I'm patient. Okay, fine.
And Dani is the doctor. Okay. So let's see. We have general practice. This is for the doctor, yes?
Yes, I can split the screen for the patient, or how should I? Yeah?
Yes, if you can do it, it would be great.
Yes.
Mm-hmm.
Okay, just give me one moment.
It will be interesting, I think.
Guess so.
We will see. Sajini, have you been a patient so far?
No.
No. Never?
No.
Come on, your husband is a doctor. He should have treated you at least once.
No. No way.
No?
No.
You avoid the family treatments, right?
Yeah.
I can understand this.
Do we have access on the exam to the patient card as well?
No.
No,
Yeah.
Can't.
No.
the patient card, no.
The interlocutor will keep their cards and you will have yours. You will need to deduct somehow to infer their meaning. So I have a general practice setting. Yes, I have a GP. And the patient. I remind you that there can be a patient or the family of the patient, mother, father, husband, wife, child, and so on. So I have a 44 Oh, please move your screen. You are the homework
Yeah.
part. We have a 44-year-old being referred to your clinic due to high cholesterol and hypertension. I think we are already accustomed to this type of conditions. Okay, high cholesterol, frustrated. So you can see here that you have a patient who is frustrated. Yeah, this is the first signal. Remember, Sajini, that this is your attitude. So,
Okay.
Dani, can you read your task?
Sure. Setting general practice, doctor, a 44-year-old has been referred to your clinic due to high cholesterol and hypertension. They are frustrated about attending today. Task: find out what the patient thinks the purpose of the visit is today.
Okay, so this is the first task. And then?
Explain the implication of a high blood pressure and cholesterol on current and future health, strokes, heart attacks, or kidney damage. Discuss cholesterol lowering drugs and antihypertensive and explain their benefits. Find out about the patient's lifestyle, smoking, drinking habits, and advise the patient on how to improve her health, reducing smoking and alcohol consumption, joining a support group or seeing a counselor, and increasing exercise.
Okay, great. Now, Sajini, can you read your
Yeah.
role?
Yeah. Setting general practice. Patient, you're 44-year-old who has recently been told that both your cholesterol and blood pressure are high. You don't really want to take any medication. You don't really want to change your lifestyle because your health has been fine. Tell the doctor that the nurse referred you, but you think you're wasting everybody's time because your health is fine. Be dismissive of the doctor's warning about the future. Your friend has high blood pressure and cholesterol and they are fine. If asked, tell the doctor that you are reluctant to take statins because you have heard that they can cause problems with your joints. If the doctor asks, divulge your alcohol and smoking history, 10 cigarettes per day for the past 25 years, 2 pints of beer each night, reluctantly agree to reduce how much you drink and smoke.
Okay, perfect. Thank you, Sajini. So, according to what we have discussed before, it means that the doctor is the one leading the conversation, not the patient. The doctor will need to ask open questions at the beginning to define the problem and then guide the patient into the direction they need. And most important, the doctor is the one matching to the patient needs. So you will always follow the needs of the patient. You are not going to have an independent dialogue by yourself. Good luck, my ladies. Let's start.
Thank you.
Remember that the doctor starts.
Okay.
Okay, then I start. Good morning. My name is Dr. Gorchaya. How may I address you?
Good morning, doctor. I'm feeling totally fine today, but the nurse who is sitting outside, she just referred me to have a look on you that my blood pressure and cholesterol are high today.
I see. Would you mind if I take your blood pressure first?
Yeah, sure.
Okay, I see you do have a bit of a high blood pressure. And
Okay.
I would like to tell you a few things about it. Would you like me to do that?
Yeah, okay.
Okay. I would like to start by telling you that a high blood pressure could affect your life and your health, and it could lead to strokes, heart attacks, or kidney damage. And also the high cholesterol could affect your vessels and lead to another problems in the future. I would like to address those concerns. Would you like me to tell you a bit about the treatment?
Yeah, but I don't think so it will cause any problem because some of my relatives and my friends who have been with blood pressure and cholesterol, they are doing fine right now.
Uh, I can see what you would think that on a short period of time, the complications might not be so obvious, but on a long term, this condition could affect your health and could be problematic for you. This is why I would like you to start a diet and some medication. Would you like me to tell you a bit more about it?
Okay, but I'm not much comfortable with taking any medications.
I see. I think we should start with a diet then. For lowering your cholesterol, you should avoid any fat in your foods. I think you should also avoid sugar. And another very important thing is to avoid salt in order to for your blood pressure to remain at normal levels. Do you think you can do that?
Okay, let me give it a try.
Okay, so that would be on about the diet. I also think at least for a short period of time, you should start a treatment with something called statins for the cholesterol. That would be only for a short time, for a month or so. And after that, we should do some additional blood tests. Do you think you can do that?
No, doctor, I'm really concerned about taking statins because it may have side effects, like it may cause joint problems to me. Since I'm old now, I'm just worried about taking statins, taking medications due to joint problems.
I would like to tell you that you are correct. A long time treatment with statins could cause a joint problem, but you're not going to need them for a very long time. So this side effect won't be present.
No, doctor, I have heard from from my many friends that they have joint problems, so I don't want to take any medication.
Okay, I think we will have to just work with your diet. And I would also like to ask you a few questions about your lifestyle. Do you think that would be okay?
Yeah, yes, doctor, you may.
Okay, let's start with smoking. Do you smoke?
Yeah, doctor, I'm smoking for a period of last 25 years, like 10 cigarettes per day.
Okay, I can see. Do you think you can reduce that amount of cigarettes?
Yeah, I will try to reduce because I don't want to take medicines. So anyhow, I'll try to reduce my cigarettes, doctor.
That would be very good. I think you should do that. And if I can help you, please do not hesitate to call me. And
Yeah, sure, doctor.
can I ask you a few more questions? Would that be okay?
Yeah, fine, doctor. Yeah.
Okay. I would like to ask you about alcohol consumption. Do you drink alcohol?
Yes, doctor.
Okay. Could you tell me a bit more specific? How much alcohol do you consume?
I take a beer, like 2 pints of beer every night.
I see. I would like you to stop consuming alcohol, or at least I think we should try to reduce that amount. Do you think we can, let's say, let's reduce the amount to 1 pint of beer each night?
Okay, let me give a try, and I'll try to reduce it.
Okay, so we've talked about diet, about smoking and alcohol consumption. And I would
Okay.
also like to tell you a few things about the importance of exercise. Do you exercise?
Not often. I just go for a walking 1 or 2 in a week.
This is very good. Walking is a really good exercise. You should do it for at least 30 minutes every day. I think that would improve your health overall.
Okay, I think we spoke. I think we spoke enough. Thank you, doctors, and I mean, thank you, the doctor and the patient, of course.
Okay.
It was great. Congratulations. And Dani, you really led the conversation, which was very nice.
Thank you so much.
I would ask the questions more in a. You somehow use your tone as if the sentence continues. Can you tell? So I would stop when you ask a question. Be firm, yes, and stop there.
Okay.
Do you want to do this? Okay. And what I would do more in my perspective, it would be good if you would have you will organize a review. You will ask the patient if they understood completely what their tasks are, what they need to do for the future in order to prevent those pills, taking pills that she does not want.
I had a very strong-minded patient.
Yes, yes. But it was a good exercise. I liked it.
Thank you, Sabine.
Congratulations.
Okay, thank you so much. Since it's my first time of being patient, so
Of being a patient, you've been lucky so far.
okay.
I hope that this luck will last forever. Okay, so I suggest we stop sharing, Ganda, and we go to the next task, the one for nursing.
Yes.
Let's choose or let them choose. Maybe Christian, I know that Christian wanted, so I would go with Christian. And who else? And Claudio. We'll have two guys. We had two ladies, and now we will. Nicoletta, are you disappointed? Because you wanted to be the patient, right? Okay. If Claudio declines my invitation, you are the next one.
If she wants, she can go.
It's easier. It's good for you, huh, that she wants to take your role. Okay.
No, but if she wanted first.
Okay, so Nicoletta, please join Christian. Nico, you'll be the patient. Christian will be the nurse. Christian is one of our nurses, a great nurse who has just overcome a very difficult episode of COVID-19 in his life, and he is the living proof that COVID really exists, and this is not a media story. So he was very ill. He also received oxygen, right, Christian?
Yeah, I was in hospital.
He was hospitalized, and fortunately he survived. And now he's a great, brave nurse who is going to have his pin soon. Now, so Christian, would you like to read the task, please?
Yeah, so a 67-year-old patient who had hypertension with no cause for many years has come in for a follow-up appointment. His or her blood pressure is moderately elevated today, and he or she appears anxious. The task will be find out if the patient has had any issues complying with the medication or exercising, eating healthy, explain the importance of medication for blood pressure control, and discuss lifestyle changes that the patient can make to reduce the blood pressure. Example, taking medication as prescribed, increasing exercising, and eat a healthier diet.
Not a big difference between the doctor's tasks and yours. So, Nico, the patient?
Yes, you are a 67-year-old and have had high blood pressure for many years. Your blood pressure was well controlled with medication and diet, as well as exercise, when you were working. But since retiring 2 years ago, you have let your routine lapse. You are nervous about seeing the nurse because you don't want to be judged for not managing your blood pressure correctly. When asked, reluctantly admit that you haven't been taking your medication, exercising, and eating healthily all the time. Explain that you have been feeling fine and don't think that your blood pressure is an issue. Ask the nurse why you have to take so many medications. Be resistant to making any changes to your lifestyle initially, but eventually agree to the nurse's suggestions.
I think you can do this.
Right?
Okay, let's start. Good luck.
Thank you.
Hello, my name is Nurse Christian, and I see that you come to us with a hypertension episode, and you're for a follow-up appointment. Can you tell me more about your hypertension issues?
Hello, doctor. Yeah, I have hypertension issues for like 2 years now, and I've been taking medication for that, so I feel fine. I don't know.
Do you take your medication regularly? do you have any values for your blood pressure? Do you mind if I will take your blood pressure right now in order to see your baseline?
Okay, that's fine.
Okay. I can see your blood pressure is quite high for your age. It's like 176 over 111, which is quite a high blood pressure. Are you enrolled in any diet? Like, let's say you have like any, do you have like a controlled diet?
Well, I was recommended to consume a healthy diet, and I try to stick to it as much as I can.
Did anyone recommend you to eat less salt or less greasy food, you know, with less oils
sure.
and stuff like that?
Yes.
Do you do any exercising? Do you walk or any other type of exercise?
Well, to be honest, I don't think they help. So, not really, no.
The general recommendation will be like 30 minutes per day of like general walk, you know, like an easy walk around town or stuff like that. Do you think
but
you can...
I tried to do this before for a couple of weeks and I didn't see any improvement. So I don't know. I don't think they help, to be honest.
Right. Do you do you think you can try at least to walk at least like let's say start first day with 5 minutes per day, and next following days you'll walk more and more in order to observe that and to note that on a piece of paper, and I can you know, I can see afterwards if things are improving or not.
Well, I don't know. Maybe I'll try, but you know, I am very busy. I have to look after my nephews during the day, so I don't have much time for myself.
I can understand that, and I have kids of my own, so I can understand that will be a difficult task. But in the same time, it's important for you to have a good blood pressure in order for the future, in order to take care of them in the future, because high blood pressure can lead to strokes or heart attacks, and
oh my God,
that eventually will lead to death. So
well,
it's important.
that sounds
for you
very
to,
scary, doctor.
Yeah, I can understand that as well, but in the same time, you need to be presented with all the facts, and you need to try to improve your lifestyle in order to be healthier, in order to...
Okay, that's enough, Christian. Thank you, Christian and Nicolette. So for a first time and for a first task, Christy, you've done pretty well, right? Nicoletta was a very good patient for you. So she tried everything. There are some things to improve. What do you believe, Wanda? Can you give Christy some suggestions?
Yes. Well, first of all, with practice, more fluency will follow. Okay, you probably have noticed that you had a lot of ums.
I have like a lot of juddering, you know.
Right. So that will go away in time. Let me think. Well, the questions you asked were more or less correctly formulated. You followed the task. And you, I like the fact that, well, here maybe at the end you were a little bit too drastic when she said that she was scared by the fact that she can die from that. And you said that, you know, but she has to know the facts. I completely agree with you, but we should always, yeah, we should always show more empathy, a little bit more empathy.
Absolutely. Okay. What else? Do you have any?
What else? What else? Well,
I wouldn't use my personal experience. Yes, I know I also have children and so on. So you are there to agree, no, to say that you understand. You can understand this, but we are not there to bring our personal life in the story, because then it would becoming personal. We don't keep formality anymore. This is another piece of advice. Okay, for the rest, I think you have done, as I said, a very good job, which will be improved in the future. Thank you very much. So, Andoza, please stop sharing, and I would like to ask our students, let's say, what are the things that they understood from the story of the that we presented today? What are the details that you noted down, first of all? Yes, nobody? Okay.
I wrote down myself all the speaking strategies that your colleague that.
Can you tell us some of the strategies that you wrote down?
Treat the role that played as the patient is like a real patient. It's not your medical knowledge which is tested, so you can it's your effective communication which is actually looked for.
Exactly.
Use intonation. Pronunciation is important.
Absolutely.
Vocabulary is also important, and you need to use a wide range of words in order to impress the, you know.
And talking about intonation, I would also bring into your attention the breaks during your speech. So the natural breaks that will occur, the natural pauses. Yeah. Great. What else?
Try to speak.
Christian, he's not the only one here.
Oh, right.
Okay, to talk loudly, clearly, and to speak loud, clear, and bold enough.
Yeah.
And you should read the role play code carefully, and to brief the notes, and you should be ready within the 3 minutes that what you're going to ask for or what you're going to answer for.
Yes. So remember that the task should be covered in those 5 minutes, and you have those 3 minutes beforehand to prepare. Well, this was our speaking today. I hope everybody had something to understand and to learn out of it. And we are very happy to have here our international students, of course. I'll see you next week with, we will see, maybe some reading, maybe some writing. We will decide, I will decide together with my team, and we will wait for you again in our extra session, extra free session. Have a great week. And of course,